Hey Mo, the doctor is in.
Hey, Ricky, the doctor is indeed in. How you doing today?
I'm good. I got on my like big St. Patrick's clothes, right?
Mm-hmm.
All the green I have is for for Dartmouth and Lakes.
I love it.
But
I didn't know. I forgot today was St. Patrick's Day, and somebody reminded me because I'm wearing green scrubs. And whether you are green with pride, I got on my green AKA jacket today, or whether you are green with nausea, or green with envy, or green with whatever. Today is a good day to talk about side effects of chemotherapy, because we all know that it can certainly make you feel a little green, and it ain't easy being green. So we're gonna
and
get into it today, right?
any day you can celebrate whatever it is, I celebrate it.
You
So
got that right. Absolutely.
people have,
Green for all the good fruits and veggies we're going to be eating. But let's talk about the side effects
yeah,
of chemotherapy, because, the studies show that Black women are less likely to undergo chemotherapy than our counterparts, but more likely to need chemotherapy because of the very aggressive nature of the breast cancer that we get diagnosed with. And we're not always told about all the side effects. And, if we really look into the data, you'll see that there aren't enough studies that look at how we respond to chemotherapy compared to our white counterparts. And so it's really important, I think, to get these perspectives and to demystify chemotherapy. We're not going to vilify it, we're not going to glorify it. We're just going to tell the truth and, talk about what it's doing, and how we can manage the side effects and the symptoms of it so that we can live, and we can live long, healthy, happy lives. So that
yeah.
being
Also,
said,
we get this list. You go and you have a meeting with the doctor, and they get the list. And so, what does the list say? It says hair loss, nausea, fatigue, all the stuff, right? But what they don't talk about is how that will impact your life. So when you start thinking, like, I think I remember a couple weeks when we had the husbands on, and we had one of the wives had these beautiful dreadlocks she'd been growing for 25 years, and her hair was beautiful. So it meant, that was a huge part of her, was to lose those locks, right? And to have to experience that. And clearly, we are not our hair, but still. And then when you think about, okay, I'm going to be nauseous. Well, for how long is this going to last? Like, how is that going to impact me? Can I go to work? Can I cook dinner? Can I feed my kids? Can I read a book? Like, what does that mean? So you have this list of things to deal with, but you really don't know how it's going to impact your daily life. And no one really prepares you for that, except other breasties. Hello, right? You have to call a breastie to find out, well, what did that
yeah.
really mean for you? Because we all experience different things, but the doctor or the nurse navigator just, oh, don't worry, you're going to get through this. And so it's not a notion. It's more than a notion. It is not fun, and it really takes a toll on everything we do. So we have some fabulous, 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 badass breasties to help us out today to talk about this. So you guys, let's do quick introductions, and then we'll get into a conversation. And I would love to hear you guys talk about chemo sucks, side effects suck. So, Vanessa, you want to go first and introduce yourself?
Yes, I will go first. My name is Vanessa. I am 34 years old. I was diagnosed with breast cancer at the age of 33, April 15th of 2020, so just last year. And yeah, that's it.
Great. You had side effects. I can't wait to hear your story. But welcome, welcome, welcome. And Ari, our baby Ari survivor. I call you my baby survivor, Ari.
That's what I was going to introduce myself as, the baby. Hey everyone, I'm the baby. I'm Ari. I'm a two-time cancer survivor at the age of 22. I was diagnosed the first time when I was 19 on January 29th, 2019, and then I was re-diagnosed on May 22nd, 2020. So I just finished my second treatment this January. So yeah. I'm excited to share my side effects because I feel like that's like the biggest part of a whole cancer journey, for real.
It is, it is, it is. And Dr. Cordai.
Hi, my name is Dr. Cordai Decoto. I'm a board certified podiatrist in Essex County, New Jersey. I was diagnosed at the age of 44, 12/3/2019. I just completed all my treatment as of 12/7/2020, and I'm on tamoxifen for the next 5 years. Side effects, Yes, from nausea to neuropathy or tingling in your fingers, which for any doctor knows that's not a great thing, to being constantly fatigued and chronic upset stomach. Those were my side effects. Thank you.
Great, great. And Nicole, so glad you're here.
Hi, my name is Nicole. I was diagnosed with triple negative stage 2B breast cancer at the age of 40, October 2019. And I had a lot of different side effects from chemo, which definitely caused me to lose a lot of weight, be very nauseous, and the neuropathy, bone pain, and the list goes on.
So yeah, so let's talk about this. So what do you think, what would you say was the worst side effect? The thing that hits you the hardest? Like, what was the worst thing you felt?
Bone pain.
Bone pain,
Wow.
definitely.
The bone pain?
I think because of my age, I would say my hair loss. It was very hard losing my hair and being in college. So that was one of the biggest things for me, and the nausea too, because I was already a super nauseous person before I got on chemotherapy. So I thought that was like going to be one of the things I struggle with. I don't know why, but I throw up more than an average person should. So I already have like a sensitive stomach. So I thought that the chemo was going to make everything worse. So I literally had to keep Zofran on me at all given times. So I'm like, oh, where's my Zofran at? Oh, it's in my backpack. Let me go get one. For
I
sure.
think for me, mine was diarrhea. Unfortunately, people think that when you're going through chemo, you only throw up because that's what they see on TV. I didn't have any of that. I just looked like I was completely dehydrated by day 2 and ended up in the infusion center by day 3 or 4 because I couldn't tolerate anything. And I would go eventually with a million drugs that was put on. It was a cycle. I'd be sick week 1, by week 2, I was eating good. By week 3, I was eating house and home and start all over again. And the bone pain, I had an episode of that, and that was not pleasant.
So we should talk about, for people who are watching, especially for caregivers, what chemotherapy is, I think, and why it causes some of the side effects it has. So chemotherapy is whole body medicine against the fastest growing cells, which are cancer cells. And the different medicines target the cancer cells at different phases of their growth. So some cells are reproducing, some cells are growing bigger before they reproduce. Some cells are nearing the end of their life cycle, and the chemo targets them at different times. But the reason you have this sort of constellation of side effects is because the fastest growing cells are going to be, well, your hair cells, right? Hair, lashes, brows, nails. It's going to be your GI, your stomach, your lining of your intestines that regenerates every 7 or so days. It's going to be your red blood cells. And so, if a medicine wipes out your red blood cells and your white blood cells that fight infection and inflammation, something has to stimulate them to start going again. Something's got to like jumpstart the car. And that's what, this medicine does, that stimulates our bones to start producing again. And so bone pain is a very real side effect. But, the one thing I will say about chemo, while it's not fun, is that when it targets the fastest growing cells, we do see a response. And I don't know how many of you had to go through your chemo before your surgery. And what that did to your tumor. And I wonder if you could talk a little bit about that too, just as we talk about the side effects. Can you, Dr. Corday, can you tell us a little bit? My soror?
Absolutely. Hello, Sor. For those who are not sure of the term we're using, we're a member of the greatest sorority in the world, the Alpha Kappa Alpha sorority. So thank you, Monique. But I had neoadjuvant chemotherapy, which means that chemotherapy is done first to shrink my tumor. I had HER2 positive, ER/PR weakly positive stage 2A cancer. So my oncology team thought, based on the type of cancer I had and the size, that they could shrink it to minimize my need for, a mastectomy or radical surgery. And it did. I mean, I was so shocked that I touched myself and I was like, there's just no way. Like, Ricky, I was in shock. And I called my colleague, as I said, and she came in and she said, what happened? I said, I don't feel the tumor, but you're gonna have to pinch me because I'm probably high off of some medication. So please check me. So she jumps over and she's like, I don't feel it either. And literally it was like a celebration in the room. And so when I had my surgery, my pathology came back all clear margins, thank God.
That's good. You had done the work, right? Right.
Yes.
Oh,
Yeah, I started my first chemo in February 2019, and by May 10th of 2019, like my tumors were undetectable. They couldn't even see them on the ultrasounds. So when I had my double mastectomy, she was like, there was nothing but a tiny itty bitty little crumb left in there when she got it. So yeah.
What about you, Nicole? Can't hear you.
Can you hear me now?
Yeah.
Is that better? Okay, good. Yeah, I had chemo first, and it was a bit rough. You know, I started with carboplatin and paclitaxel, and you know, that really wiped the first round, really wiped my system out as far as when you say the white blood cells, it really dropped it significantly low, to where I didn't get chemo again for a month. Because my body was like, what in the world? So they had to reduce my chemo amount like 20%. And then I had a reaction and things like that. It was a lot of different things to where they had to change to a different chemo regimen. So when I went to the AC, the adriamycin and the Cytoxin, I didn't get but 50% dose. And when I got that, afterwards, I had my MRI of my breast, and they did not see the tumors at all. So like for me, you know, my body could not take chemo, not full strength. But it was surprising though that the regimen that I was on and the types of chemo that I was on, it drastically like diminished the tumor to where when I went into surgery, they couldn't differentiate between unhealthy tissue and healthy tissue. It was just kind of like, it just killed it completely.
That's its purpose. Thank God for that, right?
Yeah.
Vanessa, how about you?
Well, I actually had chemo after I had my double mastectomy. But I mean, those side effects, I was not prepared. More so, I mean, the physical, definitely there was the bone pain, the night sweats were insane. But definitely the mental and the emotional, like I did not realize that it was going to take that much of a toll on me mentally and emotionally. That was something that they definitely couldn't prepare me for. But I mean, I had a little bit of nausea, but most of my side effects were the bone pain, really, really achy back. I mean, there was at one time I actually had, I don't know, I believe it may have been an allergic reaction, but I had hives like all over my back and like my arms, and yeah, it was definitely something I was not prepared for. They can tell you what the side effects are, but nothing prepares you more than actually like experiencing it.
Right. Hey, Mo, can you explain what causes the bone pain? You're on mute. You're on mute.
Mm-hmm.
Okay.
I can. So the easiest way to think about it, I think, is like it's like our children. You know how kids have growing pains, right? They get pain in the growth plates in their bones because their bone marrow is stimulated to produce. And so the medicine that helps our bone marrow to make new cells, it stimulates our bones basically to grow. It makes them do things, and it causes pain and discomfort at those growth plates. And so, you know, bone pain is a side effect, but it also signals that, you know, your bone marrow is working and that your body is replenishing the cells that get wiped out by the chemotherapy. And so my question for all of you guys is, you know, The doctors and the nurses and all, they tell you what the side effects are, but did anybody tell you any great things that make some of the side effects go away? Or is it always like, well, you could do this, you could do that, you could do this, and you can try that? Because I feel like we're good at telling people what could happen to them, but then once it happens, we're not great at telling them what to do about it.
Right.
I know for me, I wasn't prepared. When I was losing weight drastically because I was so nauseous, I couldn't eat much of anything. I couldn't even really drink water because the water was even making me more nauseous. It got to a point where it was a physician assistant. I couldn't see my oncologist, and I saw a physician assistant, and she was like, well, you could come in and get fluid therapy. I think you need that. And by that time, I already was in like three or four chemo treatments. So it's like, wow, it would have been something nice to have at the beginning. But it really helped the hydration because I did get severely dehydrated. Yeah.
I want to take that one. And that's sad that they didn't tell you that. And again, that's why I said I'm such an advocate for this, because I was in a unique position where my colleagues are my friends. I mean, I know them. So it was like, I didn't have to ask. They were like, okay, so you're coming in for fluids, right? Okay, because you don't feel well. You're sick, right? Here you go. So I think I was given more than the average person, or sometimes too much, where I was like, oh my God. And, as Vanessa, I think you were mentioning allergies. I have mast cell disease, which means that I react to everything doubly. And so my allergist immunologist got involved, where I couldn't even do chemo at the infusion center. They thought it was way too high risk. So I had to be only at the hospital, where they had a crash team just in case chemo didn't go my way. And that's terrifying, regardless of my field, I'm a person. And I was like, oh Lord, please don't take me now. So that was a big thing. So the fluids helped, for my GI problems, and getting the GI doctor involved with medications I was on. And for the bone pain, which I'm sure we'll go into, Neulasta and Claritin. And those two things were, as Dr. Mo is shaking her head, were key. I was fine. No problems once I stuck to that regimen. And that's what I did for the entire chemo sessions that I had.
That's good. I know for me, after my first chemo, I got C. diff. So I got a bacterial infection, right? Who knows what C. diff is? Whoever heard of that, right? So I'm like coming out of every piece of my body, everything's coming out. I couldn't hold anything down. And so 3 days later, one of my friends came, and they said, you're going to be nauseous and get diarrhea. Well, I was, and I had it. And so one of my friends, who a nurse, came over, and she said, no, Ricky, this is not from chemo. This is something, you have something wrong with you. Like, we need to call the doctor. Because I didn't know. They said you're going to get that. How would I know what the chemo reaction is without having it, right? I was totally dehydrated, and I'm spending 2 days in the hospital. We went to the hospital, and they said, well, you have C. diff, and which caused me to be on more medication. But by my second chemo, I had lost 30 pounds. And so, but again, it was because I didn't know. Had my friend, who was a nurse, said, well, you're going to feel this way, but if you really feel this way, then you better do something about it. To your point earlier, how do we know what it's supposed to feel like? They say you're going to get nauseous. Okay, I did. And, I did get diarrhea. I got all the stuff. So, but there's so many unknowns about it. I had no idea that I had a bacterial infection, and it probably was based on the chemo, but it wasn't necessarily a chemo reaction that I should have expected, right? So I didn't know enough to be dangerous, and I ended up being in the hospital for 2 days.
And it causes severe dehydration. That type of diarrhea, it's a bacterial infection that's resistant to a lot of drugs too. And it really does wipe you out, Talk to me about your energy level, I think, before chemo, because one of the things I think we can do better with is letting people know just how tired they're going to feel, and maybe some ways to combat that fatigue, right? So did you all experience fatigue during your journeys?
I would say personally, I was very fatigued. Like, I would go to bed around 7 o'clock at night. Like, I could not stay awake. Like, my head was dropping. I would say it was very difficult for me, and let alone, like I said, I'm in school. So I know you guys don't live in Texas, but I live in Texas. I go to Texas State University. This school is pure hills and stairs, the entire school. You cannot escape any of it. And so when I was on chemo, I would have to leave my house like literally an hour early just to get to class because there was just so many stairs and hills. And that shows how tired I was, because it should only take you like 10-15 minutes to walk across campus to get to class. So I was like super, super tired my first time. And even my second time, I know we're just talking about chemo, but I was also very exhausted from radiation too. I would have to get like take a nap every time I would get a treatment, like go straight home and take a nap. So I would say I was pretty fatigued from everything.
I was still working part-time. I could not be full-time because I have privileges with hospitals to do procedures and seeing patients. And it was just too crazy. I was like, there's just no way. For me, I used a personal trainer because I had done some of the research about exercise and cancer, and I had my sorority sisters walk. So I had, even though I was tired, I would probably feel more tired, I would say the day of chemo, because I was on medications to prevent my allergies. So like Benadryl, so I was high. The day after a little bit, then I would have a surge of energy because I kept up with the exercise. And to what you're saying, Ariana, about the radiation, that was my biggest fear. And my trainer had me moving twice a week, doing crazy stuff with him, walking. I only had fatigue on my last day. My girlfriend, one of my good girlfriends is my oncologist, and she came by to pick up some food, and it was like she jinxed me. I could not sleep enough for 3 days, and then I bounced right back. So I was kind of happy with myself because, obviously I'm older than you. And also I was just like, I'm working, how do I do this? And then COVID hit. So all of those things, I was high risk where I was taken out of work for a while because nobody knew what to tell me and they were terrified. I mean, that was just what it was. So I just tried to do as much, eat well, meditate and exercise to keep my energy up so that I wouldn't get sick from the chemo or, God forbid, COVID.
Right. It's kind of like you're on this roller coaster. So you have chemo, you get all the gunk, you're out of it. And then it's almost like as soon as you start to feel like a little bit normal, then you have to have chemo again. Right. So you may have like 1 or 2 days where you can like have felt recovered, and then bam, here we go again, right, on that ride. So you're like on this like, and I guess also maybe the first chemo you recover like in a week. The second chemo, you add a couple days to it, and the third chemo knocks you out. Like it's all cumulative, right? And you're like, whoa. So you never know what's going to really happen every chemo. Like you don't know how you're going to feel, so you can't really plan anything. You can't. You just have to like let it take over. Take over.
Absolutely.
I experienced a lot of insomnia actually. Like the days that I had to take my steroids, the dexamethasone,
Oh my God.
I had the amount of insomnia that I had was horrible. I would be up until like 3 o'clock in the morning, go to sleep for a few hours, and I was right back up at 7 a.m. eating because I was starving, but I really wasn't. But those steroids, they really
Those
gave me
steroids are
insomnia.
no joke when it
No
comes to the eating.
joke.
Like I know Nicole was saying that you lost 30 pounds. Well, sis, I must have took them because I got 30 pounds in 2 months. I was like, I went from like 128
Yes.
to 160, and that was like a huge jump. Like I'm talking about I had to buy a whole new closet. Like, and they were like, oh, you're gonna lose it once you get off. So I don't know if I was supposed to be here in adulthood. Like this is just what I was gonna grow into eventually. But I'm here now, and it looks like it's staying. So
You look good, darling. You look great.
You look pretty.
You look great. But it's also
Thanks. I would look at old pictures and I'm like, okay, maybe I did look a little anorexic. Maybe I did need this because I have a lot more meat on my bones. Now I look more like a woman instead of a kid. So
And every chemo is different too. I think that, chemo is like the word cancer, right? That's a blanket term. every cancer is different, even stage for stage, even ER
Mhm.
positive, PR positive, HER2 negative. Every HER2 positive cancer is different. And so chemo regimens can be very tailored. And for different cancers, those chemos are different and then given in different frequencies. So for people who might be watching, I know I have a good friend who's watching, his mom had ovarian cancer. That chemo is a lot tougher because it's given more frequently, and it depends on your stage too. So, you know, the side effects vary. And I think that we need to talk about, you know, some of these other side effects like, well, we're going to get into the bones.
Yeah.
Let's talk about it because, you know, we don't talk about Black women's bones enough. It is assumed that our bones are denser, just like our breasts are denser. We're less likely to fracture them, but our doctors are also less likely to talk with us about osteoporosis and about bone health. And Ricky, I love the campaign that Touch is doing that focuses on walking and focuses on bone health, because it is an area that we need to be exploring, and we need to do research into what happens with Black women and our bones when we're on these estrogen blockers, because estrogen blocking can decrease bone density, right? But it hasn't really been studied in Black women, really. You know, we know that Neulasta can cause, you know, bone pain and can stimulate our white blood cells and our bone marrow to grow. But are we studying these things and what happens in Black women? So let's talk about these bones, y'all. What did you know before and what have you learned since?
Work out. That was my fear. I guess anyone over 40, okay, there's only a couple of us here over 40, you know, even Ricky.
Oh,
Nicole.
I'll take it.
Yeah, I mean, we obviously as you age, you're more at risk for any type of osteoporosis or osteopenia, softening of the bones. So now I'm over 40 and I got cancer and you put me on Neulasta. I mean, so weight bearing activity help keep your bones strong. Dark green leafy vegetables, even though I really couldn't eat a lot of vegetables. Like every time I eat a vegetable, I'd be sick to my stomach. So I didn't do as much vegetables as everybody had an opinion trying to tell me what to eat. And I'm like, do you understand? My stomach does not care what you think.
Right.
So
Thank you for that, right?
Yeah, it was killing me.
That's a great line. Don't tell me what to eat.
Exactly. So I had like, you know, I did some of the Caribbean drinks. I'm West Indian. That helped, but I lifted weights. And that I think was important for me to do twice a week to keep those bones strong. I was consistent. Even if I missed today, my trainer might be watching this. He knew I'd be like, okay, my makeup day is when, like, it was not an option because I was like, I'm not going to fall down and break a hip in my 40s. That's crazy. Or my leg. Plus, you know, in the field I'm in, I think there would be some comedy to it as well. So to me, you know, the physical activity is what helped with the bones, keeping them strong. The Neulasta, obviously, to keep your infection at bay, and the Claritin, because, and Dr. Mo, I'm sure will go into it, for the histamine to stop that reaction of that crazy pain that I didn't know could exist. And I was like, who hates me now that my bones feel like they're breaking? So I'm sure the other ladies on here, because I see them smiling like, yes. Mm-hmm.
I know the first time I got the bone pain, I thought the cancer had gone to my bones. And it one was those nights, Vanessa, where I couldn't sleep from the Dexa, whatever that crap, horrible stuff Sarah was. But I woke up at like 4 a.m. with this shooting bone pain. And I was like, oh my God, the cancer's in my bones. And this was probably my second chemo. And so of course I'm like emailing my doctor or whatever at 4 a.m. Of course, there was no answer to that. And what really helped me then was I went into the Triple Negative Breast Cancer Foundation discussion groups. And Ricky, take a Tylenol and go to bed. You're going to be fine. But no, again, that I didn't have a warning from my doctor. I didn't know that I was going to have that. And it's almost like you feel so out of control. It's almost like you're having this out of body experience with chemo, right? Like whose body is this and where did this stuff come from, right? And you don't know what to expect and you have no control. So, I mean, I don't know what things you can do or we can help people with it, like other than what to expect, but also what can you control? That's what we call the show, like the day after chemo. Like, what do you want that to feel like? What can we do to help us get there? What can we do where we have some level of control over what's going on with our bodies? And like one of the things I think that you guys were helpful in telling me was like, it's the Neulasta Onpro. And you know, like that, that was one thing. And Ari, do you guys want to talk about that a little bit? That was a great thing to be able to do and not have to go back out. Like, so, you know.
On top of the bone pains, I feel like I also had pain like in every part of my body that just has muscle. Like my forehead was achy, like my arms, my legs, my butt, like any part that had tissue almost felt super achy. So I felt like the fact that I had the new Neulasta patch and I was able to stay in bed the day after, because I feel like the day after for me was the worst day for me. So not being able to like not having to go back to the doctor's office for me and get those several injections for my immune system was like I was pretty grateful for that. And on top of Neulasta, it kept me in school because everyone was so scared about me being on campus and me being around so many people. And everyone was like, "Oh, just take time off." And I was like, "Nah, I ain't doing that." And so it allowed me to stay on campus and be around everyone and still like be around my friends and everything like that. And even attending church too made me more comfortable with attending church because everybody loves to hug in there. And so, and tap your neighbor too. So I was like, I don't want nobody tapping me. I would be like, don't, please don't tell them to tap your neighbor. So I was like, the last it really made me feel a lot more comfortable about like being out more socially too, especially for my age group. Cause I feel like I just wanted normalcy in my life. Like nobody should want to experience this, but being just so young, I was just like, oh my gosh, it just felt like my whole world was flipped upside down. So I'm glad I was able to like do a bit to make me feel my age.
And just to chime in here about Neulasta Onpro, which is what we're talking about. So the first 24 hours after chemo is given, it wipes you out. It's like one of those oh boy, if you ever watch The Matrix and they go through and then they push that button and it wipes out everything in the area. And chemo is a blast to the whole system, including the bone marrow, including the white blood cells that fight infection and inflammation. And so 24 hours after that, we give women something, we give patients something to help their bone marrow and to improve their white blood cell counts, their red blood cell counts, so that they won't have high levels of infections. And so that's usually the time frame. And before the sort of on pro or the on body patches and attachments and devices, people would have to go back into their cancer centers. So the next day after chemo, you feel lousy. You've been up all night, chills, achy, nauseous, diarrhea, whatever symptoms you might have, and you got to go back and get an injection. And so, having that Onpro has really saved people from having to go back, especially during the time of COVID, especially when transportation has been scarce, especially, when you can't bring anybody with you. Like we wanted to keep people out of hospitals as much as possible. So it's been really helpful. And Cordai, to your point about the histamines, right? So one of the beliefs, and we don't know why the antihistamines work, but we think that the same reason that the NSAIDs or anti-inflammatories do, because the bone pain is from swelling. And so you're swelling in this closed space, and it's a histamine or an allergic reaction. So if you can decrease the swelling through things like Tylenol and ibuprofen, or if you can decrease the histamine or immune response, which is a different part of the immune system, if you can decrease that through Claritin, that will help to reduce some of that bone pain. So that might be why it works. But it is really, I think some of my patients have said that was the worst part of their chemo was some of that bone pain. And the other thing people should know is that sometimes the chemo itself, those Taxols, the paclitaxel, can cause bone pain too. So how do you know if it's cancer, if it's medicine, if it's Neulasta, arthritis? How do you know?
Look, I didn't know, I didn't care. I know Claritin worked and I was sticking by it. And any cancer patient who's talked to me, I'm like, Claritin, because I did not want to be on any type of pain meds. I was already paranoid that I was on a whole protocol for cancer because of my allergies. So to your point of talking about steroids, Ariana, when you said, yes, you gained weight, and Nicole, you lost weight, I had to do oral steroids 2 days before, an IV drip during, and 2 days after every time I did chemo. And even when I finished traditional chemo and I went on IV hormonal therapy, it didn't stop. So my weight was going up and down and fluctuating, and over 40 is a little bit harder than, when you're under 40. But now I have a handle on it. But that was real. And the steroids, it was supposed to be helpful, but I didn't think they were. And like I said, the only thing that worked, because I tried Tylenol the first time, I was like, add the Onpro, and I was like, oh, I don't really need this in my mind. And I would never say that again. I mean, I was like, if I'm going to use this, on pro, I'm going to take Claritin. And once I stuck to that, I was good. I really was.
Yeah. I didn't have Onpro. In fact, back then I had to take a drug called Neupogen,
Mhm.
you know, 9 years ago, whatever. And so they taught my daughters how to give me the shot in my stomach. So then it became, okay, mom, it's my turn to shoot, mom. And were having too much fun with it. So I was like, hold on a minute, hold on. But I think the Onpros, I wish I had had that, because it seems like it's so much easier, because you don't have to leave your house. It's automatic, and you get the medicine that you need. You have to, because we were always like, oh my God, it's 24 hours. Get the shot, or do I have to go back to the doctor to get the shot? So I think that just takes one thing off your plate and gives you some control, But Nicole, do you have any?
Yeah, I just wanted to say, like, my journey in general with like Neulasta Onpro, it became a part of my treatment plan. Because like I said, when I got my first treatment of paclitaxel and carboplatin, it literally wiped out my white blood cells. I mean, it dropped it so far low. I think I was like 0.3 on my ANC. And so that's the neutrophil, absolute neutrophil count. And so I couldn't get chemo. You at least most cases, I think, have to be a 1, and so, or higher. So week after week, like the next following week, I got Zarzio. My insurance company did not want me to get Neupogen. They didn't want to pay for it. So I had to get Zarzio, and you have to go back 2 days. Day 1, go back again for the second shot, day 2. And it's like, you're feeling like crap. Because for me, by day 2, 3, that's when the chemo hit me the hardest. So yeah, definitely having to go back for 2 injections to increase your white counts. It was not fun. And then it didn't work that well. And so finally my insurance company said, okay, with the Neupogen. But then my oncologist, he just told me after my chemo regimen changed to Taxotere and Carbo every 3 weeks, every 2 weeks, 3 weeks, because my reaction to chemo was so bad that I'm gonna have to have the Neulasta Onpro on my arm. And that literally helped me a lot, because it helped me to have chemo. It really brought up my white counts. And that's really the only thing that helped me. And it even helped me during surgery. My white counts plummeted, and I was given that again, and it helped me to get my double mastectomy to boost up my white counts. And I would say, as far as the bone pain, yeah, I went from paclitaxel and carbo to Taxotere and carboplatin. And yeah, I experienced the bone pain. When I got the Neupogen, I mean, not Neupogen, but the Neulasta Onpro, yeah, by day 3, like the chemo, you have the Onpro on your arm, it takes effect the next day, 24 hours later. By that 3rd day, I was in bed. I could not get out of bed. My bone pain was really bad. And I definitely was the Claritin. But what someone didn't tell me, which I wish my oncologist did, was that I needed probably to be taking the Claritin maybe 3 days or so before, and then follow it up. And that would have helped me. So when I started getting on that regimen from a breastie, a friend told me, like, you need to take this Claritin before you take your chemo and before you do the Neulasta Onpro. And it really helped. It really helped to kind of decrease it. Did it take it away? No. I mean, I've never had occipital bone pain, like the back of my skull hurting. Like, that's how bad my bone pain was. So
From the chemo.
But from the chemo, but then also on top of that, the Neulasta Onpro, it can cause you to have some bone pain. But the benefit though was I didn't have to go back. I got my chemo on regular schedule, and I didn't miss any treatments because my white count was low. So,
Yeah. Yeah, and you touched on a whole nother thing, is having to skip a chemo. Like, I had to skip 2 chemos, and because my white count didn't recover. And so that is just like a frightening thought, right? When you're sitting there, you're all primed to go to chemo. First, you pump yourself up to go to chemo, right? And then you get there and your blood work isn't good, and they send you home. And, well, when can I come back? Well, I don't know. You can come back when your white count recovers. And so And then you sit there like, okay, well, is the cancer attacking me anymore? Like, what's happening to the cancer? What's going on in my body? And that fear is horrible, So, you want to have that drug in your system to be able to recover so you can have chemo, because that's really fearful. I don't know if you experienced that, Vanessa, at all. Anybody? Yeah, that was not fun.
Yeah, I definitely I mean I experienced a lot of the bone pain. But much like the ladies, I was very thankful that I didn't have to go back to the infusion center the day after chemo. It allowed me time to just kind of, I don't know, relax, I guess you could say, and process everything that I was going through. And then also, just avoiding, you know, people, especially with the virus and all of that. So um, I was very thankful that I was able to get the Neulasta Onpro, because I was able to just stay at home and heal. And then, much like Nicole said, by day 3, that bone pain definitely kicked in. My first infusion, it completely slipped my mind that I should have started taking the Claritin a few days prior to my infusion. So I started taking it the day of, and that didn't do anything for me at all. Um, so then my infusions after that, I was like, okay, I'm gonna start taking it a week prior to, just to make sure it's good and it's in my system and it's doing whatever it's supposed to be doing, and it helps a ton with that bone pain.
Why do we have to figure this stuff out for ourselves? Or we have to talk to another breastie, right? Like,
Mhm.
almost like, there you go back again. Here's the list of all the stuff, but no one says, okay, here's what you can do about it. And at least we have some tools in our arsenal, like the Neulasta Onpro, and the Claritin, but we don't. It's crazy that it's not being handled as a thing, because it's huge. And Ari, you said earlier that the side effects from chemo were like the biggest issue for your whole experience. So it's, we're dealing with this, and everybody that's on chemo is dealing with this. And why is it so hard why do we have to figure it out as patients? And maybe we all have slightly different experiences, but like, gosh, like,
I think you're right, Ricky. I think there's room for us to better prepare patients. And it's hard when you're trying to wrap your mind around cancer and am I going to die and all the other things and what do I have to do and what am I FMLA and paperwork, and like your mind is reeling in 1,000 different directions. And if someone were to sit down and tell you exactly how nauseous you would be, would you have gone through it? If someone were to tell you that your bones are going to ache and this and that, would you have done it? And right, and your outcome have been different. And so I think there's a balance in terms of giving people the information they're ready to receive and doing it in a really stepwise fashion that makes sense, right? You don't just bombard people with all this stuff all at once, because your mind is already reeling. But as they're going through this process, walking them through it, and this is why touch is so great, and this is why we have to have this toolkit to help people along when they're ready for it, because they can give you a million pamphlets. We give our patients a whole binder full of stuff, and what do they do with it? And they're already overwhelmed, and they've already, your eyes start crossing reading all these words, and so it's a tricky thing. But I think that pairing patients up with advocates and with breasties is probably one of the most powerful things that helps you, because you learn from somebody who's just gone through it. Oh, let me tell you what I wish I had known. Let me give you some tips on things like, cold cap. I want to circle that because we have a question in the chat about cold capping and neuropathy. And I know Dr. Cordi has to go.
Unfortunately, I have to log off for
tell us
another event.
about hair loss.
Thank you for having me.
Oh, wow.
Thank you. It was so nice meeting
for being
you.
with us. Yeah, thanks for being with us.
Nice meeting you.
We want you back for part 2.
Yeah, Dr. Mo, I'll be back on the 28th to talk about neuropathy anyway, so don't worry, I'll be back.
Yeah, you'll be back.
Okay.
Yeah. Seriously.
I wanted to say, Dr. Mo, that I definitely agree with that. Just like seeing it within my field. I feel like if we were to give all well, sorry, y'all. I'm going to school to be a radiation therapist, so I graduated in May, woo woo. But I feel the same way. Like if I was to tell all of my patients, like, oh yeah, this radiation's gonna stop you from being able to hold your bowels. Like, I don't feel like they would want to go through it, or your skin is gonna rip open and it's gonna look pink and it's gonna smell, and like I feel like we give like the vague version so that they're not so overwhelmed with the treatment process. So I feel like I could definitely see that.
But we got to tell the truth too, you know,
Yeah.
and
I tell
yeah.
the truth.
Yeah, because I feel like for me, I wish that I was prepared. Like little things are big, like the metallic taste that you'll have in your mouth with chemo. No one told me that. And another breastie, a friend of mine, Shavana, she went through, the same disease as I did, triple negative. And she's like, girl, stop eating with metal forks. Try plastic. It'll help you better. And it's true. Don't eat with anything
That's
metal.
always my number one too.
Yeah, do not eat
ugh.
with anything metal when you're going through chemo. It will make that metallic taste in your mouth worse. So everything needs to be plastic or ceramic or something like that. Like little stuff like that. Like my nails turn black, and I think I read in the triple negative breast cancer Facebook page, like, oh, you should have painted your nails red. Like, who knew that helps to decrease the blackening of your nails if you just kept red coat of paint on them, like little stuff is huge, especially when you're going through it. And then, like I said, I lost a ton of weight. My doctor didn't have me on any type of steroids. I didn't get steroids until the day of chemo, as the kind of like the prelude to the chemo, that little batch of stuff that they give you. So that's the only type of steroid that I got at that time. So when I was losing weight, I got all the way down to 113 pounds. Like I never in my life was that small that I can remember, and I just had a baby, at the time, she was 10 months old at the start of my cancer journey. So I still had some baby weight. So I dropped a lot of weight real quick. And so it's just, there is just some stuff that I would totally agree that maybe it would scare us, and, maybe not get into too much detail with some things, but other things I would, like, for instance, with nausea, I was given Zofran. Well, Zofran makes you constipated, and so can chemo. Some people can get diarrhea, others sometimes get blocked up, and because you're dehydrated, you're not drinking enough water and things like that, and you're not eating, so you get constipated. So then you take Zofran and you get even more constipated. So it's like, there's other anti-nausea medications, the compazine, and I think there's another one, and at the end of it, when I was going through the AC, I was taking three different anti-nauseas. And then another breastie was like, you need to do CBD. And I know that's not a part of the conversation, but I started taking CBD oil,
Yeah.
and that was a game changer. It helped me with my nausea and gave me some energy, Yeah. So, I never heard of CBD, really, to be honest. But
my kids like made butter out of it and started sneaking it to me. I didn't know what it was. And
but
so
it didn't have the marijuana, it's not marijuana. I don't think it's marijuana. It doesn't have
Another
the-
conversation for another.
Right.
We have to have it. We got to talk about it because
But
it
it
is
helps.
natural
It
and it's
does.
muscle
And it
thing
helps
and
with the
everything.
pain.
Mhm.
I'm sorry, Dr. Mo, but
Mhm.
yeah, it also helps with my pain. I
yeah.
didn't know, so it helped me with my nausea, it helped increase energy, and it helped me with my pain.
It helps
Yes.
my patients with sleep too. So
Yeah,
the
well,
ones who are really
and
having
food.
trouble sleeping as well.
Sleeping
So there,
food.
there are definitely
I
some benefits.
always want to recommend it to my patients that have bone meds, but I don't want my supervisor to be like, girl, what you talking about? So I'll just be like, oh, man.
So today,
Man.
I actually found someone today, a researcher that I haven't spoken to yet, that's basically doing a study on the impact of that with cancer. And so I'm going to get some more info on that. We'll
Yes.
try to do a show
It's
about
just not enough research about it. I
Yeah.
feel like that's why it's not really.
conducting
Stay
a study.
tuned. It's coming though. It is. Yeah.
We'll
Mhm.
get some info on that. We'll definitely get some info on that because my kids definitely were sneaking it to me, and I'm like, these scrambled eggs taste like dirt. What did y'all do to them?
I would say though, just a caveat, with the Neulasta Onpro, I was getting it on my arm. And so I told you that I lost a lot of weight. So my arm's not very fat. I would say the best place is the part where you have the most fat. So they stuck it on my stomach.
Mm.
That was
And
helpful.
honestly, yeah, I think that one, I didn't feel it was just weird. I felt like maybe it went through more of my fat and not directly into, like, because I think at one point when the nurse, the technician or the nurse, she stuck it on my arm. When I took it off, I bled a lot. And I had a little bit of a reaction. They think that maybe it hit like a superficial vein or something, and it probably affected that a little bit. But I would say if you do get the Neulasta Onpro, place it where you got a nice pad of fat. It doesn't, you know, it doesn't bother you as bad.
But, you
Been
know,
on a little.
all of these things, though, you know, we probably need to do a page on the website about what's the real deal on side effects, because you guys are bringing up stuff that no one told us about. You know, no one told us about. And to your question earlier, Mo, you know, when you're so told you're going to die if you don't do chemo, you know, you sort of have to sort of suck it up. It's like the COVID vaccine, you know, it doesn't feel that great and you're going to have side effects. But, you know, when you have a choice between death and
Oh no, it's a lot of people not choosing that COVID vaccine right now, though, Ricky.
but it's almost like you have to sort of live through this stuff
Yeah.
to get the outcome you want. And you know, you have to just I called it doing the work, going to work. What's the work we have to do today to save ourselves, right? Because what are you gonna do? You can't really not choose it. You just have to figure it out. But that's why we have to help each other with it, because we're not hearing it from, you know, from the doctors. Yeah.
Vanessa, what else
Yeah,
do you
Vanessa,
wish?
you're shaking your head, yeah, babe.
Yeah.
I'm sorry, I didn't catch it. What'd you say?
Oh, I was going to ask you, what else do you wish that you had known before, or what advice would you give? I know we're getting ready to round up the hour soon, but what advice would you give somebody who's getting ready to start chemotherapy?
First thing is definitely give yourself grace. You are going to have some difficult days. So that would honestly be my first word of advice. But in regards to dealing with the side effects, you know, the physical, definitely start taking that Claritin at least a week in advance. I mean, Claritin's safe for you to take every day. So you could honestly just get in the habit of taking it every day so that you're not rushing to go take it, you know, a couple days before your infusion. But some other pieces of advice, definitely get into journaling. That's something that is very, very important during that time. Have have stool softeners on deck just in case you deal with constipation. What's the other one for diarrhea? I forget the name of it. Yes, Imodium, have that. Aleve is a good one to have. And I would take the Aleve in conjunction with my Claritin, and that really helps it.
Yeah. And I do talk, you know, we kind of skipped over the whole bone conversation. You know, we are walking and dancing and all that stuff, I think helps you, you know, just to be outside, you know. So, you know, we do a dance party every Friday at 3:00 on Facebook Live, just 15 minutes. Nicole's been there, and you got to come and get us some young stuff because I keep playing 70s music. But I'll put the link in the chat.
That's the exact music that I listen to. So you probably wouldn't help, but pretty much.
You know, we're doing Earth, Wind, and Fire, and you know, whatever.
Eddie Pendergrass, Bill Withers. Yeah, the list could go on. I'm saying I was born in the wrong generation, y'all. I swear.
It's a good party. It's a good dance party for sure.
And then we do a walk the first Saturday of every month at noon Eastern time, and we walk for 30 minutes and do a power walk because we got to move. And I want everybody to be outside, and you know, that's where you see God, and you sort of say, okay, you know, if I am going to deal with all this crap, I need something to connect me to nature and the world and the bigger world around me, and just give you a different perspective on your life when you're fighting all this stuff that you're dealing with. And so
I would say one thing also that I wanted to add, since I was able to experience 2 different cancer journeys, you know how someone's like, man, I wish I could have done it different. Well, I got to do that. So I feel like one thing that I majorly did different with my second cancer treatment and my side effects was I started to embed a little bit of more holistic stuff in there too. Like it doesn't really cost much. There's no side effects to doing holistic treatment. So I was just like, why not? So I got some acupuncture done. I did some cognitive brain therapy. That was really nice. It was just like a little workbook and like things of that nature, thinking of more like mind over body, like speaking like positive thoughts into my mind to help my physical become better, you know? That's a very important part of treatment. Like you were saying, Vanessa, just like the whole emotional part with it. Um, so I would say that made a huge difference in my side effects and my whole my treatment plans the first time versus the second time.
Wow.
What helped me too, I would say yoga. I was introduced to doing a little bit of yoga before COVID hit while I was going through chemo, and that really helped a lot to just kind of get me moving, get me breathing, because breathing, just in general, the way you breathe can really help change everything internally, reset your heart rate, respiration, help you to relax. Because a part of the chemo too, sometimes there's an anxiety, you know, aspect too, I felt with chemo, you know, because, you know, every time you get it, it just kind of seems like it just causes you, for me, it wiped me out. Every time I got it, I felt like, Lord, okay, is this week going to be more 4 days, or now I'm going to be more pushed to 6 days out, you know? And I had 2 small kids, so I had to keep moving for them. So yoga was I felt very helpful to kind of get me more centered.
Yeah.
And stretching, absolutely. Those stretches are so important for your bones, for your muscles, for your diaphragm, for your circulation. Because I think we don't talk enough about circulation either. You know, this blood has to get from everywhere and to everywhere. And, you know, how do we get that happening when you don't feel yourself, when you don't really feel like moving too much? And you're right, it can be just a stretch and a deep breath. You know, I tell my patients first thing in the morning before you even get out of bed, start breathing, start stretching, and start your day with that. Try to end your day with that, and every point in between, if you can get some of that in, because it helps to keep the circulation going as well. So these are really great topics. I think we have to put together a toolkit, Ricky,
I think
for
so. Yeah.
Yep, on our page, on our website, for people who are going to go through chemotherapy, you know, with some of the things that you wish you knew, some of the products that work for you, some data about some of the things. I know people in our chats are putting in articles on things like acupuncture and CBD, and there is some exploratory evidence. Acupuncture has been shown to help with things like neuropathy, with bone pain, potentially not as much in randomized studies. But you know, there are things that we can do, and it is sort of like trial and error, unfortunately, for a lot of these side effects. And you know, we need to give people more things to try and less room for error, because when you don't feel good, you don't have time for that, you know?
No, and when you're not feeling good, you don't really know what you're dealing with, you know, and you're already in it. So it's hard to say, you know, it's hard to, you got chemo brain going on too. So you you forgot, darn, I didn't take the whatever. I should have done that this time, or it would have helped, you know, because there's just so much
I'm
going on.
surprised nobody's brought that up sooner. The chemo brain, that stuff was crazy. I know one time
Tell me
I
about
called
it.
my apartment to make a complaint because they did a work order or something. And it was like, I just got home from chemo, and I called them. I was like, why do y'all do this every time? Blah, 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 blah. And she was like, you live at these apartments? And I was like, oh, no, I don't. I'm sorry. Goodbye. Hang up. I called my apartments from like 2 years ago. So I lived in 2 years ago. I was like, oh, yeah, I just need to take a nap.
Oh, wow.
What helped me with that was puzzles, because I have small kids. Like, to try to help keep my brain going is helping my my then 3 going on 4-year-old build her puzzle pieces. It kept me sharp, because when I realized I had chemo brain when I was looking for the milk, and when I opened up the pantry, it was in the pantry. So I was like, yeah, this is real.
That's so crazy, right? You were just, you know, it's out of control. So I think we should put something together that sort of helps everybody have a list of tools. And, you know, Emily, our awesome health storyteller, is, you know, watching, so she'll help us put when we can put something on our page on Facebook to help people like just deal, right? And put things back into our control, and now also we can ask our doctors like, okay, what is it? Tell me about Neulasta on Pro, so I don't have to come back to you. Tell me about, do I take Claritin? Tell me about, when I should take the Tylenol. Tell me about, what the impact of that what is it called? Dexamethasone?
Dexamethasone, the steroid.
I was a crazy person. So, it's also helping us, at the end of the day, I think that, we don't even know what to ask doctors about. So if we can even equip people with things to ask about that we don't experience until we're in it, I think may be helpful. So we'll work on that too. So we thank you guys.
Yeah, I want to say too that, for all the things we didn't get to, because in the chat is going crazy with chemo brain, with neuropathy, with so many other things that we want to talk about and that we will absolutely talk about. So please know that this is not the end of this conversation, and that in the coming weeks, we are going to be talking about all these topics and giving them enough time and energy that they deserve, so we can come up with some solutions and help to add to that toolkit. So every week we're going to put a couple more things in the toolkit for our breasties. So we are thankful. I'm thankful for you guys sharing your stories and making it real and keeping it real, because I tell my patients the only way through it is through it. You got to go through to through. But if you can get some help along the way, so you know a little bit more about what to expect. I think that Nicole, I think you mentioned that. Like if I knew what to expect, I could plan and prepare myself and I can be okay. But it's the unknown that's so hard.
It's so hard not knowing what to expect, and maybe because it is so different for everybody, that's why doctors don't really tell you. But even just having something bigger than that stupid list, and that's why we have Breasty Love. That's why we have Breasty Love, right?
Well, we'll work on it for the doctors too, because we don't know everything, and a lot of doctors don't talk about what they don't know about. And there's room for us to educate ourselves. And so I'm going to take the feedback from you guys and pass it along to the doctors and the nurses as well, and make sure that we start to give them some tools and a little something in your pocket, so that when your patients are asking you, here's the reference article for acupuncture or for CBD or for yoga and exercise, so that you won't just say, oh, well, you could do this and you could try this and you could try that, but the actual data behind it. So we can educate the docs too.
We need to tell everybody everything, so and you guys, also the chat, I'm just looking at the chat. Oh my gosh, there's a lot going on in there. So guys, if you have ideas, want to talk on the show, want us to address topics, we have so many topics. We're scheduled out for like a month or so, but email me, email us info@touchbbca.org. We'll take it to heart. We'll call you, we'll get your stories, and we got to talk about it. We got to help each other out. That's what Breasty Love is all about. That's what the Dr. Do is all about. So,
well, we hope this has been relatable, reliable, and real. Is what we set out to do every Wednesday night. Those three things. If we can get that done and get some education and make some people smile and laugh and know that they're not alone in the world, then we've done our job for tonight. So thank you guys so much for joining us.
thank
The
you.
doctor's in.
Thank you so much.
To Amgen, our sponsor of the show. They're a great partner for us and give us lots of information and lots of good stuff that they do for our breasties. So we thank you, Amgen.
Thank you so much.
Thank you guys so much. Thank you so much. Next, we're going to talk about lymphedema.
Got to. Yep.
That's
absolutely.
a new rules for lymphedema. So we're going to talk about lymphedema. So if you've got it, all right, see you then.
Wednesday night, 6 p.m. Eastern time.
Breasty Love. Love you guys. Thank you so much, Breasty Love.
Love you too.
Bye.
Bye.